presenting with neck and shoulder pain, and on the left hand side it's going down the arm. Very tender everywhere. The left shoulder along a big muscle called trapezius, and it's going into the arm. Is it tender? How far down the arm does it go? Into the elbow or not quite?
No, not into the elbow. Tendon touching there.
Anything on this side at all?
No, this one's fine.
So Shana, can you tell us what you're going to do in this procedure today?
So what I'm going to do now is to insert acupuncture needles into tender points in the patient's neck and shoulders, and I'm then going to apply electroacupuncture, which is the use of a small current to help stimulate reflexes within the needles and through the body to help remedy the pain. So I'm putting them into the neck, and obviously it's important to be aware of the anatomy of the body. The needles don't go in very deeply, but they're going into the neck muscles, and you can see how that has instantly gone very red around where the needle is, and that shows there's a lot of inflammation generally in that area. This is an aseptic technique. That means I'm not touching the needle, I'm using a guide tube. The needle is going in via the guide tube, and when I tap, it goes into the skin.
Can you tell us something about this patient's condition and how acupuncture is helping?
Well, my patient's been attending 7 years now, and has in that time had chronic neck pain in association with cervical spondylosis, which is spondylosis of the spine of the neck. And unfortunately, the client had a car accident prior to her attending her first consultation and treatment, which has then exacerbated or made worse her condition in the neck. And she comes on a regular basis, on a sort of 4 to 6 weekly basis, depending on how symptoms are, for pain management, and it works very effectively.
And how many needles will you use today?
So I will probably use somewhere in the region of 10 needles, but the important part of her pain today, which is going into her arm, is actually applying the electroacupuncture, which I will come to in a moment. So at the moment I'm just working along these tender points in the trapezius muscle. Where it's tender. There? Yeah. One particular point? Or
from here down.
There?
Yeah.
That needle gone into the deltoid muscle. And I'm just going to look at the front of the shoulder joint to see if there's any tendons there. There. What we're going to do now is to apply the electroacupuncture lead.
Can you just explain what they do, Shana?
So it generates a pulsation through about 6 Hertz through the needles, and this then evokes pain potentials and pain relieving qualities within the body via the brain again and the spinal cord, and releases neurotransmitters to help release pain relieving chemicals, which then obviously makes the condition improve. So you're going to feel a sensation now in this area of the body. Tell me when you get pulsation coming through. Okay, not too strong?
No.
Okay. And now you'll feel it around the neck area and the lower neck. Then when it's coming through. Can you feel the heat now? Please tell me if it gets too warm. Is that okay?
Sounds good, yeah.